Hi, I'm Greg Chambers. Getting good cure rates from your mastitis treatments is crucial. However, many dairy farmers are not getting the cure rates they should because of the way the treatments are used. Today I'm going to discuss how you can get the best possible cure rates so you can get those cows back in the vat as fast as possible. I'm going to focus on three key areas: identifying cases promptly, selecting the best treatment for each case, and using best practice administration technique. Ensure your milkers know the signs of mastitis so they can identify and treat cases early while they are easier to cure. Clinical signs may include clots and changes in the appearance of the milk, a hot, swollen or painful quarter, and possibly a sick cow. Clots on the filter sock and rising bulk tank somatic cell counts should alert milkers to a mastitis cow in the herd. The best thing you can do is ask your vet for a treatment plan specific to your farm. I strongly recommend you take milk samples from mastitis cows and freeze them so you can use them later if need be. Generally, environmental bacteria like Strep uberis dominate mastitis in the spring, whilst contagious bacteria like Staph aureus are more common in mid to late lactation. For mild spring cases, you could use a routine treatment with a short withhold such as Clavulox LC. For more severe cases, retreatments, and mid to late lactation mastitis, you could choose Orbunin LA or Mastilone. If you're milking once a day, make sure you select a treatment with licensed withholding periods for once a day cows, such as Lincolnson Fort or Orbunin LA. Before treatment, you should milk out infected quarters as thoroughly as possible to remove mastitis milk and bacteria. Milk them out twice a day if possible. Before treating the cow, it's important you use strict teat-end sanitation. This step is often overlooked, resulting in the introduction of bacteria into the quarter, more mastitis, and an apparent treatment failure. Use teat wipes and thoroughly clean the teat end using a clean area of the teat wipe every time. Keep cleaning until the wipe comes away clean. You may need to use several teat wipes. Then infuse the antibiotic, taking care not to touch the tip of the tube. The same procedure applies to dry cow therapy or teat sealants. Make sure the treated cow is identified. We recommend the Dairy NZ Mrs. T approach. Mastitis cows should be run separately and milked after the main herd. Make sure you give the treatments at the intervals shown on the label, which could be 12, 24 or even 48 hours between treatments. Always finish the course of a treatment to reduce the chance of having to come back and retreat the cow. Withhold milk for the number of hours or milking specific to the product. Be careful as this can vary widely between products, and some products have more than one withholding period. This withholding period app is a great tool to tell you when cows can go back into the vat. If the mastitis hasn't cleared up after the last treatment, you can extend the treatment with the same product or switch to a different product such as Orbunin LA or Mastilone. If you extend the number of treatments, you should use a product with a licensed milk withholding period for extended therapy, such as Clavulox LC or Orbunin LA. So, to get the best possible cure rates and cows back in the vat as fast as possible, detect mastitis cases early, give a full course of treatment with the best product, and use strict teat-end sanitation. Go to our website for more information and sign up for news. If you have any concerns about mastitis, make sure you talk to your vet.